that was the kind of first part of our day, looking at the kind of, if you like, natural science, biomedical science impact on the pandemic. I've been joined by Siobhan O'Neill, Professor Siobhan O'Neill, who is a close colleague and has worked for years on the issue of mental health and on trauma and on the impact on so many lives in a place like Northern Ireland. Siobhan is Professor of Mental Health Sciences here in Ulster University, and this year, during the pandemic, she was named Interim Mental Health Champion for Northern Ireland, something which people have been lobbying for, not least Siobhan herself, for a long time, which has put her right in the forefront of public conversations as well as academic conversations around mental health, mental responses to mental health, and some of the challenges which the pandemic have raised for us. So there literally is nobody better that we could ask to speak to us today on the topic of the impact of COVID on mental health and the mental health implications of COVID, and what have we learned and what should we learn from what we've experienced over the last 15 months. So Siobhan, you're very, very welcome. Thank you for doing this, and we look forward to what you have to say.
Good morning. Hi, everybody. It's a pleasure to be here. I'm going to share some of my slides. So fingers crossed, this is always interesting. So we move the window. Oops. A wee bit of tension there as we see if this works. Okay. That should be us now. So super. So thanks for having me, Duncan. And it's a key part of my role is participating in a public conversation about mental health and the pandemic, and also then advising government. So I'll be doing a bit of both. I'll be talking about the research on mental health and the impact of the pandemic on people's mental health, particularly research from my colleagues at Ulster University and some work that I've been involved in as well. And then I'm going to be talking about my trauma-informed recovery plan that I put to the government and what the executive are doing about mental health, and happy to take your questions after that. So let's get started. Okay. So even following up from the last conversation, which was, by the way, really, really fascinating. Thank you. I'm always in awe of my colleagues in biomedical sciences for the work that they're doing. But they reminded us very, very clearly there that at the end of the day, we're biological beings, and our mental health and our health is influenced by our biological responses. And those are influenced by our DNA and also the environment that we're in. So I'm starting with a little reminder about our normal stress response, our fight or flight response, the response that happens whenever we're under threat of danger. And this was really what we all experienced in buckets at the start of the pandemic. Whatever that point was, we realised that this was a significant stressor and that we would have to rearrange our lives, and that was going to be really stressful too. Many of us were plunged into this state of stress, and many even were plunged into a state of distress. So the normal response to stress is actually the basis of a lot of our mental health problems. And if we look at the normal response to stress, we can see there the features of mental illness. So stress affects how we think about the world. We become distracted. We're not able to concentrate. It affects our memory. And of course, the fight or flight response is our body's way of preparing the body for battle, so that we can survive. We can attack the aggressor essentially and survive. So this has evolved through many, many generations, and it's very, very finely tuned. But of course, concentrating is not part of this. We need to be distracted. Our brains are not focused on memory. We need to be able to fight and mobilize very, very quickly. And of course, we are irritable and anxious because that hypervigilant state is the state that's going to serve us best. We get angry. We're looking out all the time about who's out there to get us. And of course, we can see in the conversations, particularly around the start of the pandemic, there was a lot of mistrust, there was a lot of arguments, there was a lot of debate about masks and people that didn't want to follow public health advice and all of that. And that's very natural in this highly stressful situation that we were all plunged into there. The normal response to stress is also a physical response. It affects our energy levels. It creates muscle tension that prepares us for fighting again. Our startle response becomes exaggerated. We become more jittery and hypervigilant. We find it difficult to sleep. And of course, well, some people might eat more, and that again was a normal response. And we talk about the COVID stone, but that was the body's way, I suppose, of conserving energy during a very, very difficult time and preparing for a time of scarcity, perhaps. Others are not able to eat properly whenever they're under stress. And again, the digestion is kind of the second tier of activity. It's not a priority for the body. So both are completely normal responses. And then finally, we have social effects. We want to know, who do we blame for this? We get into arguments about who's responsible. All of this stuff serves us very, very well in a sort of jungle environment as animals, as human animals. However, in the pandemic, what we needed actually was calm, focused problem solving, nearly the opposite of this. So this is a state of emotional and physiological arousal, of dysregulation, and we needed to be well regulated. So what do we do in this state? Well, many of us went out and bought toilet roll, and I'm still seeing the tins of soup that I got, well, and I don't even drink all the tin soup. So we do things that are not characteristic, that don't serve us well whenever we're in this state. And of course, many of the characteristics of the fight or flight state, when we get stuck there, become the characteristics of mental illness, of mental health problems. So what we went through, and those higher rates of anxiety, or at the start of the pandemic particularly, was completely normal. And I think that's something that we need to remember at all times here when we're thinking about the mental health impact and the aftermath as well. And it's important to mention that whilst most of the research studies did show that around a third of the population had clinical levels of anxiety, if there wasn't a pandemic, you would be saying these people have an anxiety problem. There's a lot of people out here with higher anxiety, but actually it was a normal response to a very abnormal situation. Most people, however, have not developed mental illness. And one of my colleagues, Professor Mark Shevlin, was involved in a study led by Richard Bentel from Sheffield, and they followed people over time and found that over 50% were not at risk for depression, very low risk for depression. And their study showed, in fact, that many people were doing better, that there was this 10% of the population who were finding that their lives were easier. A lot of the studies of children and young people found that whenever the schools were closed at the start, many young people did better because school was a source of stress. They were bullied. That was an adverse environment for them. However, when we look at the broad range of studies, we find that about 1 in 4 people had depression in the pandemic, and 1 in 5 people had anxiety. And again, this would be more than you would expect in any ordinary year. So it did increase the rates of depression and anxiety over time. And I've given 2 examples there, again, from some colleagues of mine who'd been studying this. But we must remember that many people are doing better, and that there's positive mental health benefits that have emerged from the pandemic situation, what people's lived experience has been like. I was grateful for the opportunity to work from home, to avoid commuting so much. I spent more time with my child. And there's one Spanish study demonstrated that many people were showing the features of post-traumatic growth, that they were making meaning and finding that their lives were more enriched as a result of what they had gone through in this pandemic. However, there's a very real mental health impact and an adverse impact, but it was not equally distributed across the population. And that is a really important point. We talked about being in this together at the start of the pandemic, but actually what the data is showing us is that we were all in the same storm, but many of us had better boats. Some of us were really, really struggling. And those people who were struggling were women, people who had children at home and had to juggle multiple roles, that was really difficult, really, really stressful. And carers, people who had already very stressful lives and their services were withdrawn. So those are three groups that I would want to emphasise that the research has shown consistently were more adversely impacted by the pandemic. Loneliness is incredibly stressful. We are designed, we're neurologically wired to be pack animals. There's parts of our brain that are activated and stimulated that regulate us, that go against that fight or flight response, that create regulation, that create that safe and social state, that are fired whenever we're in the company of others, when we have those true connections and physical connections. And we're only starting to understand the importance of these connections. We know they're absolutely vital for babies and children in those first few years of life, those attachments. But that physical presence is really important. You know, we're really starting to understand that we talk about a single human organism, but actually we should be talking about communities and groups as this wider neurological system that works in tandem with each other. So we are pack animals, and when we're removed from the pack like that, it's very, very harmful and toxic and stressful. And we find it very difficult to create that regulation that we need. So loneliness has been associated with increased risk of mental illness in this pandemic. People who live alone, who were isolated, again, had more evidence of mental health problems as demonstrated in the research. Let's go back a wee minute to that previous slide. Sorry. And then we had the people who had COVID itself. And you know, the infection with COVID is associated with a whole host of mental health issues. There's the stigma of having the infection. There was also the neurological impact of the infection, and we're only starting to understand the neurological impact of long COVID as well, and the damage that's done to the body that of course impacts the brain, which is part of the body's physiology. And it's very difficult to disentangle the effect of stigma, the fear, the anxiety. I was terrified of getting the virus. You know, I had my insurance documents out at one stage as well. And because I'd had pneumonia before, you know, I considered myself to be at risk. And that was a state of anxiety for me. So people who had the virus have been telling us about the mental health impact of that. People who were hospitalised, people who were in intensive care, who had to lie on their chests, a very, very frightening situation, particularly if you'd seen all that terrible news footage, you know, and all of the warnings. And we saw that with previous pandemics, the warnings that were trying to protect us. You know, we had it with AIDS as well. The warnings were really, really a cause of anxiety for people who then became infected because they thought they were going to die in a lot of pain. And then there was the family and the impact on the carers. You know, paramedics spoke to me around the midpoint of the pandemic and talked about the trauma that they were witnessing, that they were experiencing, the checklists they had to go through when they were taking people into the hospital, people who had COVID, terrifying experiences, people with PTSD resulting from that, you know, where there's flashbacks and nightmares and memories that they just that are tormenting them, that have been wired in such a way, that have been remembered in such a way that they keep invading their reality right now. So people who have had COVID are a group that we don't talk enough about, and we need to provide them with mental health services and support. And then finally, our health workers were under huge pressure. And there's lots of evidence of high rates of acute stress, of post-traumatic stress disorder, of moral injury, of being forced to make decisions about who to treat, you know, of having to do things that essentially go against their training and their moral code as health professionals because they were under such pressure. And Kieran Shannon, who's working with some of our colleagues here in Ulster, has a lovely study there of mental health workers in Northern Ireland that's demonstrating the impact of that on that group as well. So the co-space study is one of the most important studies of children and young people. And what we're really finding is that for most of us now, as acute stress and even trauma, most of us will do okay. But when the brain's developing in those early years and on into the teenage years, the traumas that happen, the dysregulation can almost get wired in more quickly because the brain's developing at such a rate. And this changes the child and adolescent stress response. So it's nearly like the body's way of preparing the child for the world that it's going to live in. So acute stress in childhood and adolescence is associated with an increased risk of mental health problems for that reason. And there's also the fact that young people need to play with their peers to co-regulate. They're dysregulated when they're alone. You know, the young of any species needs to play together. And what did we do? We separated children from their peers. They became completely powerless. You know, adults had a certain amount of control over what they did. Young people were removed from school and isolated at home. Very, very stressful for them at a time when their brains were just learning how to respond to stress. So that hypervigilance was much more likely to have been consolidated there. All of this stuff is reversible if we intervene. But the coast-based studies showed us there really across the UK and now other European countries the impact of this on children and young people. And again, the impact is primarily behavioural. So we don't get mental illness, we get behavioural changes that over time, if they stay there long enough, if they're not addressed, you know, that's what a mental illness is, changes in feelings and behaviours that last for a period of time, and you need a bit of help to get back, to get away from them, to get rid of them. So we've had behavioural, emotional and attentional difficulties. Whenever young people are under stress and pressure, their fight or flight system creates that difficulty with attending to their work. So we see it in schools where traumatised children can't focus. Or children with mental health difficulties who are anxious, they just can't learn, because you need to be in that safe and social state in order to learn and be curious. So we have a third of boys showing hyperactivity or inattention. You know, schools might have seen this and thought it was bad behaviour. Parents would say, well, this is just, you know, they lost the run of themselves, their behaviours. It's actually inattention that's caused by dysregulation. A quarter of girls had this as well. The emotional difficulties in January 2021 in girls were as high as they were since March 2020. At 30.8% of secondary school age girls had emotional problems. That's nearly a third. That is huge. You know, in that age group, that's massive, because what happens there is you have behaviours like self-harm starts to kick in, or disordered eating patterns. In order to manage, in order to cope with the effects of stress, this is what girls and boys will do, and this can lead to very serious mental illnesses that need to be addressed. There was one review of 27 studies by Viner et al. That showed that school closures, and their conclusion was it led to considerable harms to health and well-being. There was an increase in screen time and social media, yes, because kids have to connect some way, and there was reduced physical activity. But we know that even the light from screens can impact on a person's circadian rhythms. Reduced physical activity, we need to be physically active to have good mental health, to have good physical health. So all of that was distorted at the same time as they were coping with the stress of isolation. And of course, again, this was not equally distributed, and the studies are showing us the kids with special educational needs and children in deprived areas were at higher risk, less exercise, not even able to access the screens that could get them connected, more hypervigilance, higher risk of being in situations where they were being abused or neglected, or they didn't. So remember, schools provide all sorts of interventions in addition to education. You know, that watchful eye, that healthy meal in the middle of the day, very, very important. Taking that away was very harmful. And in Northern Ireland, remember, we're talking about a population of young people who were already at higher risk of mental health problems. So the Lisa Bunting study, again involving colleagues here at Ulster too, Orla and Mark and Jamie in psychology, that study showed that our rates of mental health problems in children and young people were 25% higher than other places pre-pandemic, because of the impact of the conflict, because of the legacy of the conflict, and primarily because of the inequalities that exist within Northern Ireland society. Another really interesting study is from Princess Trust, and this was a study of older young people, and this study found that nearly half of young people were saying they had high levels of anxiety, 31% overwhelmed by daily feelings of anxiety and panic. And what really worries me about this study was that young people's hopes for the future were affected. Their hopes, their dreams, the things that make life meaningful, that give life purpose, that was impacted by this pandemic. So people saying that their life was on hold, over 2/3. In Northern Ireland, young people, over half had always or often felt stressed. Feeling powerless to change the future, again, something that's very worrying. And in Northern Ireland, nearly half had always or often felt anxious. These are some stats from a study of college students that I'm involved with, along with Elaine Murray from Biomedical Sciences. A lovely study that we started before the pandemic, and we took DNA samples, so that's going to be really interesting to look at the before and after. But this is called the Student Psychological Intervention Trial. And what the study showed us that in a small group of students there, a couple of hundred, in Ulster University and also in Letterkenny Institute of Technology, that the first year students had lower levels of anxiety actually in the year that the pandemic struck than they had in the first year. So going to college, going to university is a time of acute anxiety, and a quarter of our students there had anxiety, but you would expect that to go way down. It only went down to 1 in 5. 18% there in year 2. But what was really interesting is that in year 1, 14% of our students were coming to university with anxiety, and in year 2 that had gone up to a quarter. You know, that 1 in 4 is a really high rate for clinical depression there in students. Again, something that needs to be addressed, and certainly the pandemic would have had an impact on that figure. So chronic anxiety does lead to depression. It leads to depression because coping with anxiety is depressing over the long term. And then we have the figures for suicide risk have gone up there as well, 8.6% in year 2. The difference was not statistically significant there, but you can see that anyone will tell you that nearly 1 in 10 risk of suicide in our students is something that we should all be very, very worried about. And then we asked about symptoms. Anxiety during lockdown, 44% agreed and 17.4% strongly agreed. Sleeping patterns. It's a real good barometer of the person's mental health, because you know that stressed, frightened animal can't sleep. And you see there 36 and 26%. So over 60% of our students had disturbed sleep. And when your sleep's disturbed, your functioning is disturbed as well. So very, very worrying symptoms. So what do we need to do, and what are the government doing? So I presented a lot of these and other findings to the Executive's Health Committee way back in March. I think this one was. We did a Children and Young People's one in May with the Children's Commissioner as well. And I put forward the idea of a trauma-informed recovery plan, because what I'm talking about here really is a trauma-informed approach, recognising that mental health and illness is impacted by what has happened to us, and that, you know, these feelings and behaviours were normal response to stress. However, over time this could increase the risk of mental health problems, and that through early intervention we can make a huge difference. So what did I recommend? I recommended treatments especially for depression and anxiety, because these are the main mental illnesses that result from acute distress and trauma and isolation. And the losses that we found during the pandemic, you know, depression and loss are associated, anxiety and acute stress are associated there too. And by treating these conditions at an early stage, we can actually prevent them from developing into comorbid conditions where people start to use alcohol and other substances to manage that dysregulation and to cope. But again, we can reduce the risk of substance abuse and suicidal thoughts and behaviours if we get in there early. We need supports for staff, staff in mental health services, staff in health services. There was a huge surge of demand for mental health services, because people with mental illnesses were finding that their illness was getting worse. People were developing new conditions. They needed more. There was more people with mental illness, so everybody was under a lot more pressure. And then, of course, we had the staff who worked in health services who were under pressure as well. We needed support for people who've had trauma and loss as a result of COVID, as a result of their experiences during the pandemic, and as a result of bereavement as well. We need support for people who've had COVID-19, people who continue to have long COVID. We need to understand more about what the impact is and what the best treatments are for the mental health component of that. I think it's around 1 in 4 people with long COVID are demonstrating clinical levels of mental health symptoms. People who were pregnant or who given birth during the pandemic, that was a time of stress, and we know that stress in those early years, particularly parental stress, the parent and the child is a dyad, and if the parent's stressed, the child's stressed, and it impacts on that child's stress response because it impacts on those attachment behaviours. So the support that wasn't possible to be available for people who've been given, who had babies, the mother and toddler groups, the parents groups, the health visit and support, all of that needs to be reinstated, and needed to be reinstated. I think it's pretty much back now, but we need to look very carefully about the impact of that and support people. We need to promote self-care and self-awareness and a recognition that the mental health impact of the pandemic for most of us will not lead to mental illness, but that what we're talking about is stress, and that we need to continue to look after ourselves, protect our bodies and brains from the effects of stress by promoting regulation, emotional regulation, and by physical activity and connecting with people. We need a cross-departmental approach to look at the impact, to address the impact properly. And that means things like housing, employment, debt, social relationships. All of these things have been impacted as a result of the pandemic and people's experiences in the pandemic. So this is not just about what the Department of Health need to do here. In terms of children and young people, the most important priority was getting children and young people back to school. And we had a lot of debate around the sports and everything else, but that's, if you're going to get any intervention that hits a large number of people, that hits those young people who were most at risk, that getting kids back to school was the most important thing. And when they were returned to school, what we needed was a real emphasis and focus on emotional regulation, which means reconnecting and focusing on well-being, finding out what has happened during the pandemic and where those children were, and really promoting regulation through play, through music, through art. Those are the activities that will redress the balance so that everyone can get back and then eventually come back to being able to learn and focus on the academics. And unfortunately, I don't know how much of that really happened. The social and extracurricular clubs are really crucial again in helping kids connect with their friends and do all those activities that are so good for them, that allow them to process what has happened. And what we need is the summer wellbeing programs at community level. Again, the Department for Education are doing some work there, and a lot of wellbeing programs will be available now for young people. In terms of suicide prevention, we haven't seen an increase in suicide rates. The PHA are doing the ongoing surveillance of suspected suicides. It can take a while for a suicide to be registered, but what we saw in common with other countries was that there was a bit of a dip in the suicides at the start of the pandemic, and then that kind of leveled off, but there's been certainly no increase in suspected suicides. But we're still worried about this because of some of the things that the pandemic has brought: job loss, bereavement. The impact is felt a year down the line as people struggle to process what has happened, and people cope with the financial implications, the implications for jobs and relationships, and those are the life crises that can lead to suicidal behaviour. So we need training and suicide awareness. We need the crisis intervention services, and there's been a review and that review has just reported, so we're hoping for some movement and change there soon. Those universal interventions that provide housing, financial safety nets, the responses to domestic violence, alcohol, isolation, entrapment, loneliness, all of those things impact on suicidal behaviour. They're cross-departmental again. We need to remain vigilant regarding access to methods, because that is the single most important thing we can do to prevent suicides, is the way that we talk about methods, the way that we we increase awareness about methods sometimes that can increase the risk of suicide. So that's important, along with the responsible media reporting of suicide and suicidal behaviour. And finally, you know, the inequalities and mental health inequalities are really key factors that are relevant to the Northern Ireland population that explain that increased risk of mental illness, and that overlaps with exposure to the Troubles and trauma, and poverty, of course, has been part of the legacy of the Troubles too. So we need the implementation of the mental health strategy, and I can assure you that people are working really hard to get the final version ready soon. We need an expansion of mental health services generally, but we need really to look at those inequalities. So LGBT plus people from minority ethnic groups, older people who've been subjected to abuse and violence. We need services that are accessible for those groups, and services that are accessible for young people in a location of their choosing. The focus on inequalities across the government departments is important to address the social determinants of mental health. And the communities with high levels of deprivation really need to be prioritised for regeneration. And my final 2 points are that we need to remember those we have lost in this pandemic. We need to create that healing that comes through the remembering and the rituals of the funerals and the rites that we would go through ordinarily that we have missed. And we need now support for everyone to promote psychological safety as we emerge after the lockdown. And of course, we always need to try and keep this virus under control and adhere to the public health guidelines so that we don't ever see this again. So I am happy to take your questions, and I hope that was okay. Thank you.
Thank you very much, Siobhan. If you stop sharing and we can have a word. Thank you very much, as ever. A very comprehensive view of all of these things. I suppose I'll start with a couple of my own questions, and then we're getting quite a lot of questions in the chat, actually. I suppose my first one is, has the pandemic put a useful or a not useful focus on mental health, in the sense, one part of me says, you know, this has been a lens where mental health has really been taken seriously for the first time, and yet at another level, some of the things you talked about, you know, the school closures and so on, didn't appear. Mental health seemed to be, you know, something we have to deal with afterwards. So I just wanted to think, you know, do you feel that the issue of mental health in our society is now better understood as we come out of this pandemic, or do you think that there are still challenges there?
I think it's a mixed bag, as always. There's no clear yes or no answer there. So it's been useful because many people at the same time were going through something that impacted our mental health. So we were able to talk in a way that we couldn't previously, because we had this sort of shared experience. But we always know that a shared trauma or a shared adversity has less of a mental health impact than an individualised one, you know, as well. So that there's two sides even to that. But we were all able to talk about the impact of the pandemic on our own mental health. So it kind of democratised that conversation in a way. So it was socially acceptable to talk about the mental health impact of the pandemic, and we all had that, and we all knew. So in a way that we weren't talking before this about how we were coping with life's struggles, and all of a sudden we were given permission to do that. But also then there was this idea that we were all mentally ill. I think that we were all struggling, and we all had mental illness, and actually many of us had to say, no, stop. This is stress. This is not mental illness. So again, the pandemic provided a good vehicle for that conversation and that need for self-awareness, that stress part of life. You know, that there are ups and downs. Most of us will be okay, but hang on, there's actually groups that we need to look at because their mental health has really been affected here in a way, and we need to address that. So when we're all ill, nobody's ill, if you know what I mean. So we needed to pivot the conversation back to actually, let's think about the carers and those children and young people who were isolated at home. Those are the groups that we need to focus on, and ensure that they're supported and that their needs are addressed. So it was useful in some ways and it wasn't useful in other ways. And I think along with all of this, my message was always, we need to restrict the spread of this virus, because the deaths and the devastation of that will have a bigger mental health impact than the stress for most of us, what was a stressful situation of having to maybe work from home and be more isolated. Do you know what I mean? This was a very difficult conversation to have, to say, actually, this is needed to prevent the mental health impact of the pandemic, of the infection, of the death there. You know, so very tricky conversations, and I got a lot of abuse on social media, Duncan, as well, about it, you know, about saying, no, we need to wear our masks, we need to do what we're told here. Because when you're in a state of anxiety, you don't trust authority. And there were lots of messages that, you know, out there capitalised on that to feed that mistrust. You know, so, and the evidence is showing us that the people who were less likely to adhere and take the vaccines and adhere to the requirements of social distancing were the people who were most fearful and anxious. So, interesting dynamics at play.
Absolutely. You've been kind of strong on that this has not been, you know, we're all in this together, but we're not all in it equally together. And in fact, there are some groups of people who it's very clear, you know, we really are more vulnerable and need a kind of particular type of attention. There's a question here about rural and urban communities. Is that something that you have looked at? Is isolation? Is that in terms of services provision and in terms of support for people? Have you any evidence that these are the same or different anywhere there?
I don't have any evidence, to be honest. You know, the important variable here is poverty. Yeah. So if you know, it varies according to your income. If you're in a rural area with a good income, now connectivity is the other one. Digital poverty. If you have poor Wi-Fi, I mean, I was going with 4G all the way through the pandemic. Because my Wi-Fi is dreadful where I live, but I had an income, so I was able to buy the SIM cards and keep the whole thing going, and I had a job, and you know, eventually I had childcare as well, and I was able to pay for that and all of that. So I was privileged. But so income is the thing. People who live in rural areas, often there's more poverty there, you know. But there's access to green space and space to exercise in rural areas, so there's advantages and disadvantages there too, but certainly rural isolation, you know, particularly through the winter, people were really cut off, you know, because you had the double whammy of the bad weather and the darkness and the cold and everything, and then the services weren't there, you know. For people, we were really starting to understand the impact of carers coming onto people's houses and things. So that was all restricted then at that point. So there was a very cold, dark winter for people who were physically ill or who needed extra support in rural areas there.
Of course, you highlighted the issue of loneliness and the need for social contact for all of us, and the question of how that feeds into depression rather than anxiety. I suppose that was what I picked up, is that, you know, sometimes life is stressful and that leads to anxiety, but this seems to have increased. Your student cohort was very interesting to me, that that it was depression. And is that connected to loneliness? Because somebody's written here, which is Anne Butler, has said, you know, should we now be trying to re-emphasize face-to-face contact? Is that a really important thing, or how do you balance that against the kind of COVID restrictions issues and the things you were highlighting there about the potential stresses just of being in a pandemic?
Yeah, so loneliness can be associated with anxiety and depression, depending on how it's manifest. So if you're constantly thinking about how lonely you are and how, you know, that is a state of dysregulation, that's you know, an anxiety. You wake up every morning and you're worried about being alone, and you're scared about being alone and having to be alone, or the depression could come from the losses that mean that you're on your own. So it's not even about being alone, it's about how you perceive that situation, whether that's a desirable situation for you. If you know what I mean. So people who've lost a spouse or lost someone recently and then they're alone, not through choice, you know, that can be a depression that's associated with the bereavement as well. So all these things are connected, because the situations that leave us alone are situations that are also associated with mental health problems. But living alone and having all of those things cut off is very difficult in and of itself as a risk factor, you know, but you add on all those layers of factors which compound it in many ways. So depression and anxiety, and the idea of the pack animal that's suddenly removed from the pack, that's a very anxious state to be in. I would say, you know, the most important thing is that we don't get this virus always, you know, because what we will see then is a need for another lockdown, where we'll be isolated and lonely again, where more people will die, where we will lose people, you know, and that carries a greater mental health risk than an extra few weeks or even months of being apart. But it's all about how you think about this stuff. So what I would say to people is, yes, meet face to face, but please do it safely, because you do not want to get whatever, you know, stress of being apart, the stress of being affected with this virus is greater, will have a greater impact on your mental health than the stress of being apart from people. So it's balancing up those risks, you know, so important. But I would say, you know, do the Zooms in a face-to-face if you can. Have a cup of tea or a glass of wine, drink the same wine, drink the same tea. Just anything that promotes connection. If you see someone's physical facial responses, that's helpful. Go, and now we can exercise outside. I just tell people, just go to places where there will be other people. Just being in the presence of other people is regulating it. It will be helpful for you. But, you know, if we get ourselves into this dangerous situation where we're all mixing and having parties and stuff like that, and we get we have an increase in the spread of the virus, it will affect everybody's mental health more than the requirements for social distancing and even mask wearing and stuff like that. Sure, we've all got used to it now, you know, well, we are missing something there when we don't see the smile, you know, but that's when we're indoors. So I think the restrictions are really worth having for that reason, and that protects our mental health. We need to see, you know, the protecting ourselves from the virus is a way of protecting our mental health as well, because of the mental health implications of COVID.
You talked about age, and you said, you know, children and young people had a particular experience of this, and one of the things I heard you say was, you know, up to a third of girls were presenting with significant problems. Is there a gender issue in the mental health experience of COVID-19? Is it differently experienced? Is it more or less, or is it simply a question that the people react differently, or are we seeing more similarities and differences on that kind of between boys and girls and between men and women?
Okay, so boys and girls and men and women I'm going to take separately. It's a great question. So whenever that fight or flight stress response kicks off in a girl and a boy, they seem to respond slightly differently. So girls will manifest emotional symptoms, they will internalize, and so you will get the internalizing, the anxious, anxiety, the emotional stuff, and that is something we recognize as mental health symptoms. In boys, it's more likely to be externalized. It's restlessness, it's inattention, it's lack of focus, but these are both manifestations of the same stress response. But the difficulty is when it happens with a wee boy, we put, you know, we say, oh, and you know, that's bad behaviour, like, and that's where the problem is. It's actually dysregulation, and girls can show an attentiveness and lack of focus and things as well. So it's not that neat a divide. But generally, what we're talking about in boys and girls is manifestations of the same biological processes. They're just different, and these are socially constructed as well. Girls learn how to respond to stress in a way, and boys learn that it's okay for them to be, you know, and both of them need physical activity, a good diet and lots of sleep to help regulate all of this, to help get them rebalanced again. Men and women, very, very different again, but that's because of the roles, the gender roles that men and women have too. So yeah, yes, there's biological differences, and are they biological or socially constructed? Who knows, or are they taught? We're not quite sure. But women were more likely to be working at home and looking after children at the same time than men, largely, you know, and that you're trying to do two things at once. And this whole idea of women multitasking, women cannot multitask. That you can't look after a child and work and focus on your work at the same time. It's impossible. I tried it, Duncan, for a couple of weeks at the start. It's really, really stressful. So there were more women doing that than men, although a lot of my male colleagues were doing it admirably as well, you know. But that the social class differences then were really apparent, because in the lower socioeconomic groups, it was by and large women. There was more women carers. There was more women working on the front line with those COVID patients than men as well. You know, so women were putting themselves at risk. There were women going out into people's homes. You know, think of the care home workers. A lot of them were women as well. So that's where the gender difference is shown. And then, of course, women were more likely to be employed part-time, unstable contracts, things like that. So they would have lost income, more likely to have lost income than men as well.
So, I mean, in terms of policy response, and you've been working obviously as a champion of people, but also with the system, as it were, and in the middle of the system. There's a question here about, is there a possibility of a cross-departmental group to support recovery now? Who and which departments need to be involved in supporting change in relation to mental health? Obviously, health is at the core of that, but are there others who need to participate in that?
Yeah. So there's a few parts to this. So the Department of Health have a mental health strategy that was put out in the pandemic, because that was part of the NDNA deal last January, was to get a strategy and a plan. The plan included a strategy. So plan included a strategy and a mental health champion and a COVID response plan. So I was involved in all of that, and then I was asked to act up in this in the role. But the strategy then came before Christmas, and the new strategy is it's on its way. You know, it's really good. But that's really a Department of Health strategy. But if you look even at the draft strategy, there's actions in there. So the plan for early intervention and prevention is in the strategy. So now we have a plan in the strategy, which was in a plan. So the plan for early intervention and prevention, it really needs to be cross-departmental, and that's in the strategy. So whenever that action is brought forward, there will have to be cross-departmental groups formed there around housing and everything else, you know, even infrastructure and how you build a bridge, you know, in such a way that you reduce the risk of suicide, all of the stuff. Justice, I'm working with justice, education. There's the framework for schools, mental health in schools come out, and new services there and in schools, which is the remit of the Department for Education. So it does need to be cross-departmental, but the main goal right now is to get the strategy out and signed off so we can get moving, because our mental health services need reform, because our services just are not equipped to meet the demand, and they are, you know, there's lots of new ways of working that we need to introduce across mental health services to make them fit for purpose, basically. So the cross-departmental group is happening. There's an executive working group on mental health chaired by the Chief Medical Officer, including the First Minister and Deputy First Minister, and all of the ministers actually. So I sat on that group, and they meet regularly. So that's where you have your cross-departmental plan for now. But when the strategy comes out, there's an early intervention plan, which is really, really vital there too.
And tied into that, I suppose, is you, I mean, I heard this more, but the emphasis on inequalities was strong in what you were talking about, both in terms of class and then of quite distinct groups of people who are at risk here. And this is maybe a hard question within that, but because it's a bit on the spot. But thinking as you do now and looking at where we're coming out of this pandemic, where are your 2 or 3, and I'm not hung up on the number, but your 2 or 3 core priorities that you really think this now needs to happen to underpin an appropriate response to the long-term mental health issue? So your own, where do you see the priorities now lying in terms of ensuring that we do target the mental health support properly in this situation?
It's like it's a really difficult decision, because there's so many things that are really urgent in our system. But children and young people, I mean, you've got to act early in order to prevent lasting damage here. You know, and that's what I was emphasising all along. What we've got here is a situation of acute stress. We've got to find those young people who have developed symptoms and signs of mental illness. Before the pandemic, 1 in 6 young people had engaged in disordered eating, really high risk for eating disorders. Now that has increased. We know it's increased. I think we need to find those children who are on the verge of developing a mental illness, who are really high risk, and we've got to intervene. So those sort of not very early interventions, but those midway interventions for young people who are showing the signs of problems are really quite urgent. And we need also mental health services for everybody, accessible mental health services for everybody who's showing the signs of a mental health problem. But if you're going to really get bang for your buck, you've got to go into the children and young people, because the damage that's being done right now, can be reversed. But you give that a few years, and actually it will be very difficult, and it will affect the economy. It will affect everything else, and we also have, a lot of young people here will leave Northern Ireland. For all sorts of reasons that you could tell me probably more about than I even know about. But those young people and the lack of hope for the future, so our young people are leaving, and then the young people who are not doing so well educationally, those are the ones that will stay. So it just benefits so much if we support children and young people's mental health right now. And then in terms of the strategy does need to be implemented, but not all of it will be able to be implemented straight away. But that's early intervention and prevention. And then we've got a few key services that actually are so vital, and it's a dual diagnosis service for people with concurrent mental illness and substance use. We need to provide good services for them, because we're losing them, they're dying. We also need good crisis intervention services, so that people have a good intervention at a time of crisis, and that opportunity is used, to prevent further crisis, to treat any mental illness that's there, to prevent suicide. So those would be my kind of key priorities. But the strategy itself, implementing that strategy, getting it signed off and getting it implemented needs to be, and certainly in the run up to an election, that's what our political parties need to be putting in their manifesto as a commitment to this, because we're recognising that people are asking for it, on the doorsteps.
The pandemic in many ways is a lesson that not everything can be fully predicted, and we know that. But we're now, 15 months since the first lockdown, and I suppose in terms of long COVID mental health issues, so not COVID as a disease, but the consequences, what are you anticipating are the things that will have a tail from this pandemic that we will have to now factor in as things we need to address in the next years, to stop it becoming a really long-term problem, I suppose?
Yeah, I think early intervention for the groups of people who've lost their jobs and who are going to lose their jobs. We know that the job loss, income loss is associated with suicide. It's a crisis. It leads to depression. It leads to relationship breakups. It leads to a whole spiral of things. So how the end of furlough is managed, how unemployment is addressed, that is going to be really, really critical in terms of the mental health impact of this pandemic. I think there's also a group of people who've been using alcohol more. Well, there's evidence of a group of people who've been using alcohol more and who are dependent in some ways on alcohol, either physically or psychologically, or both. And I think the interventions there now to help people get back on track. So if we can, view this as a period of time where there's been a stress or a crisis, and what do? You weigh in there to support the people who've been worst affected and get them back on track again. So that's really, really important. And I think there are people who've developed mental illnesses that need to be treated early now. So those are the things. I think the substance abuse, the economic, the real tail is the economic implications. Everybody's buying houses and there's a real surge of all that stuff now, but I think there's a lot of economic adversity on the way. That's when I'm thinking about what we're planning in Mental Health Champion Office for Mental Health Awareness Day, financial, economic effects, relationship breakups, those things.
Yeah.
Those are the things.
Universities and provide a certain kind of space within which to think about these things, to give order to them, to create data. How useful has your academic career been to you in trying to apply this in the policy sphere? I mean, do you find there are bridges between what you've done in your research work, what you understand from your reading, and then bringing that into the public space? Do you think there's an important role for universities in that?
It's absolutely vital, because in order to be able to say something, you need to have the data and the evidence. You know, again, for me, I was able to navigate even the biomedical sciences stuff. You know, I had that trust. I had the critical evaluation skills, knowing where was this information coming from. And then in terms of the whole mental health area, I knew where to look for the data, where to look for the evidence. I knew the people who were doing the studies, you know, so that was really, really useful. But there are limitations to it as well. And I learned so much, Duncan, from going out and speaking to people on the ground as well, because you can get caught up with the numbers and the data and you can forget. And it's through the stories, through people telling you what it's like for them, that actually you realise the importance of the policies and the things that will make a difference to address the stuff that the research is showing us, you know, that's difficult for people. So I think it really has to be about listening to people on the ground, but even the academic training, that, as I say, critical evaluation, being able to evaluate a science paper, look at the knowledge, that the messages that you're getting, where are they coming from, the source of the evidence, being able to navigate that. My academic training and being placed in the university has been very useful, but being out on the ground has really opened my eyes to the reality of it. And I think we need to do a lot more of that, and you're doing a lot of it in your role as well. But I think we need to build that bridge, and build the bridge then to policy as well. And my role as Interim Mental Health Champion, I'm trying to do all three, to connect all three together, you know, so more of that, so that policies reflect not only the data and the evidence, but also what people want on the ground, and we're all speaking to each other, and that we're doing research that's relevant to people's lives. So
yes, that COVID, one of the things that COVID has taught us is that collaboration between the academic, the policy, and the actual lives of people who are the experts in their own lives, as everybody says, is really important for the knowledge production stuff that we're all about, and learning that is at the core of what we do. I mean, that is something we've really learnt in spades through the COVID-19 pandemic.
And I think that in terms of mental health, the champion role has been a good way of connecting policy with research, with lived experience, you know, and I'm really delighted to see that evidence base is woven through the mental health strategy as well. It's not just, you know, people tell us what they want counselling, but actually they want somebody to talk to about their problems, but, you know, and then we have to think, well, what is the evidence for this, and what does that look like? How do you structure a service that includes that? It needs to be accessible, you know, all of these things. So they are all also connected.
And I suppose one last question to you, just as we come to the end, which is, if, and I have no idea, you were to return to the university as a researcher, mostly as a professor, what would be the thing you would most like to research now, coming out of this COVID pandemic, out of your experience? What is the thing that you want to know most, that you think we need to know a bit more about?
So there's a few things, but there's something I'm working on right now. I will never not be a researcher. I think it's in my DNA. So no matter what job, like this is me as an academic. I'm always going to have that hat on, looking for data, looking for evidence. I want to know whether this has really changed our attitudes to mental illness, whether we're more self-aware as a result of it. I want to know more about stigma and how that works in Northern Ireland, about the experiences of people with mental illness. Do they feel heard more, or are they still othered? Particularly people with severe and enduring mental illness, you know, because what we've experienced really was stress for most of us. But there's still another side to mental illness that's not talked about, and it's people who are living with significant mental health problems that cause them to behave and act in particular ways that, you know, really impacts on their lives. And so I want to know more about that. And I want to know more about the positives. I want to know more about the intersectionality of different experiences in the pandemic. So what it's like to be a minority group, to be a student from another country coming to Northern Ireland, living here during a pandemic. You know, all of those sort of intersectional things I think are really relevant. And I caught the tail end of the last presentation. I want to know about the impact of COVID on neurological processes, on the stress response and on inflammation. Oh, because all those things are connected with mental illness too. So yeah, everything basically.
Well, it sounds if you're going to be busy anyway. Which won't be new either. So, listen, Siobhan, thank you very much as ever for that. I think it has been a privilege to be with you and to hear some of the stuff that is at the forefront of what you've been doing, both from a research point of view and the way that connects into the challenges that we have coming out of the pandemic. This has been a really interesting conversation, which I'm sure we could continue. In fact, I know we could continue for a very long time, and I'm sure a lot of people would want to participate in it, so we may be able to find other opportunities as we did for the last one in the future. So certainly from a university point of view, we're delighted and honoured to have it, so thank you very much. For everybody else, we're now going to take a break. We're breaking till 2 o'clock. As I said, you can leave and re-enter using the same link. And we will be starting again listening to Gareth Hetherington talking about some of the economic consequences and some of the real challenges that we face and the opportunities that might emerge now, and some of the same issues in terms of inequalities and some of the challenges that are going to be differently distributed. And then we'll hear in direct terms about youth and communities response and some of the issues that they've been researching and thinking around in terms of young people. I hope, like me, you've enjoyed the first part of today. I think it's been incredibly informative and really demonstrated for us what Ulster University can bring to this debate. But thank you again, and we do hope you'll join us again at 2 o'clock. And Siobhan, thank you very much for doing the last hour. Thank you.